Then the thing, yeah, there's root canals and even extractions. So wisdom teeth extractions, it's over 90%. I can't remember exactly. It could be 90%, 96% even. What you'll find in an extraction site decades later, what it does is it creates a jaw cavitation, like over 90% of the time. So you could just be living your life. You have that wisdom tooth out and you know, you're fine. You don't feel pain, but it can be challenging to your immune system. And that you could have one of those autoimmune things and you don't know where it's coming from. And a lot of functional medicine doctors really feel that, 80% of all sort of disease could, possibly is starting in the mouth. So you want to look at those things. So for example, jaw cavitation won't even show up on an x-ray until it's like 80% gone. So at some point, that's why we need to get to those good dentists, because you're going to want to have that checked. And what they would do is just sort of either slip in an instrument and see, is the jaw mushy, and then, and I had this done to I had three wisdom teeth out. And so because what the issue is, when the tooth is extracted, the periodontal ligament is left in. That's standard operating procedure. And a dentist explained to me that it's akin to like kind of leaving the placenta in after you've given birth. So, now of course there are surgeons and dentists that you say remove the periodontal ligament and they will. So what happens is that ligament stays there and then the gum grows over and then it creates rot. So the jawbone actually needs to be scraped, which sounds gross, but that's what you do. You're scraping out the decay, allows a blood clot to form. That blood clot cleanses the area, and then your dentist, hopefully because they're good, they're going to inject that area with ozone and then also with your own plasma. So that's when your blood is, and they should have this at the dentist's office. It's called different things in different places, but it's like PRP therapy or plasma platelet therapy. And they extract your blood, and then it goes into a little spinner, a centrifuge, and then it separates the red part from this beautiful golden plasma fluid that has all of your good things in it, and then it's injected into the area, and it brings stem cells and your own nutrients to that area for the next 3 to 6 months. And then that cleanses the area, and then you've kind of taken out this thing that could just slowly but surely be degrading your health. So that's one area, and it's a bit similar for a root canal. So if your root canal seems okay in your mouth, then that's okay, but just keep an eye on it. But what we now know, even with textbook perfect root canals, is that when they are extracted, and if they show no signs of disturbance on an x-ray, all seems fine, but when that is removed, it shows that 100% of the time there is necrotic bacteria in that root canal. So the idea of a root canal, the idea is good, the concept is nice, that they take out basically that whole pulp chamber of the inner core of your tooth and kind of cement it. I'm just speaking very generally right now. And but the thing is, each molar contains over 300 meters of microscopic tubes. One molar, 300 meters, microscopic. I can't even imagine that. And really, every time I even say that, I'm like, I know the stat in my head, but it's like, it just seems so mind-blowing that we would have that in one tooth, but that can't be sterilized, is my point. So the idea is that you would have this hermetically sealed tooth, that you can still have your original tooth and chewing surface, but it was a good idea, but it isn't. And it basically is sending, bacteria into the bloodstream all day. And so if it's a back root canal and you don't have a ton, you can easily remove that tooth. And again, make sure that periodontal ligament is moved to, and then having that site injected with ozone and plasma. And then you can just leave that there. But it is a harder decision, when it's in the front or it's going to affect you cosmetically. But the options for that, there's a bridge, but then that shaves off good tooth on each side where it would hold up a fake tooth. And then classically, people have used like posts, like a titanium post to hold in a tooth. And you know, if you have a titanium post tooth, that could also be something you would want to get with a dentist that would revise that previous work, as that is a very toxic metal. The best thing to use, because it's got a track record of about 30 years in Europe, is zirconium. So you could have, you know, if it was a front tooth, you could have a zirconium implant and then a tooth that way. But you really can leave a back molar, but hopefully, you know, you don't have a ton. And that's why it's good to keep the wisdom teeth too, because you might need them for a chewing surface when you're like 95. And again, that's a bit of a racket. You know, a very prestigious dental journal, I just can't remember the name of which dental journal, but 67% of all wisdom teeth removal was not needed. So we have to really, so it's good to know things too, because then you can question, you know, or is that root canal tooth that they say is a root canal tooth, is it really a root canal tooth? Does it just need a filling, you know, before you go all the way? Those are things that it's important for us to know, because, you know, one trip to the dentist could really be like decisions that you're making that can affect you, you know, 40, 50 years from that time.